My homegirl's crazy how I feel about you. Yeah, it's crazy how I feel about you. Take you down to my hometown. Every day I dream about the time you were. You know how I feel. I will love you every day. Let me take you down to my hometown, girl. Every day I dream about the time you were. You know how I feel. Hey, hey, hey. I will love you every day. Hey, hey, hey. Ever since I met you, I've changed to be the kind of man that you wanna take. So I'm here for you. It doesn't matter where I go, I'm already yours. Everybody else, I don't wanna know. It all comes down to you. Having all the times around you, kind of got me feeling like starting a new life now. When I leave, I can see your eyes staring in my own girl. Crazy how I feel about you. Yeah, it's crazy how I feel about you. Hey, let me take you down to my hometown, girl. Every day I dream about a brand new world. You know how I feel. I will love you every day. Let me take you down to my hometown, girl. Every day I dream about a brand new world. You know how I feel. Alrighty. So thank you very much for everyone, or to everyone, for joining the Stop to Partnerships Virtual Innovation Spotlight on Roche Diagnostics iThemba Live. My name is Jackie Ha, and I am the head of the External Affairs and Strategic Initiatives team here at the partnership. Before we dive into our event, I want to briefly note the main whys the Stop2 partnership is organizing these virtual innovation spotlights. The first reason is to provide visibility to the TB community at large, the digital health technologies, particularly solutions that could catalyze home-based care coming down the pipeline, or ones that could be translated for TB in the near future. The second reason is to strengthen the feedback loop much earlier between innovators and our partners, particularly our in-country ones, such as the National TB programs, healthcare providers, and civil society and community representatives. And the third reason, which is related to what I just mentioned, is for our partners to provide innovators the critical feedback and inputs regarding their solutions. So here is our game plan for the hour, which is quite simple and straightforward. But before we get this show on the road, there are a few housekeeping matters that I would like to quickly go over. Let me just lower my screen a little bit so you don't just see my nose. The Virtual Innovation Spotlight is being recorded and will be made available on the Stop2 Partnerships website in the coming weeks. During the presentation, except for fabulous speakers, please keep yourself muted. During the Q&A session, please use your raise hand function to request the floor. And last but not least, before you ask your question, please provide your name and affiliation so that we can get to know you and hopefully become friends. Okay, so here is a 1-minute challenge for everyone. What is the meaning behind the name iThemba? So let's give everyone a minute to write down their best guess answer in the chat box. Anyone? 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 Oh my gosh, maybe this was too hard. Okay, let me just give people maybe 30 seconds to kind of do a Google search and figure it out. Okay, so okay, so I'll just put everyone out of their misery then. May I ask Dana to tell us what the answer is?
Yes, so thanks, Jacqueline. So it's actually iThemba. It's not
iThemba.
iThemba.
Oh my gosh, sorry.
So,
oh my
so
gosh,
it's not,
this is all
it's
apples
not
and
it's not related to iPhone or Apple or anything like that. It's really
Okay.
iThemba. It's from the Zulu word and it means hope. And our thought really is that we really do hope for better outcomes and improved disease management. And so that's why the app is called iThemba.
Oh wow. Okay, I have some training to do here.
It's a very common mistake, especially in the digital world.
Oh my gosh, I know, but still, I just realized how, yeah, anyway, that's another webinar. But okay, so without any further ado, we have a very interesting and fascinating presentation from our Roche Diagnostics colleagues and friends. So please, Alejandra and Dana, the floor is yours.
Thank you so much, Jacqueline. Let me share my screen one moment here. Okay. Can you please let me know if you see the screen now?
Yes.
Okay. Well, thank you everyone for being here today. My name is Alejandra Guillén. I'm an international business leader at Roche Diagnostics. And today, together with my colleague Dana Duncan, who is our Director for Clinical Science and Medical and Scientific Affairs, we want to bring you our iThemba Live platform for disease management. We're extremely pleased to be here today because we, as Dana was saying, are working hard and really putting an effort in trying to understand which are the critical elements that individuals who are affected by TB need in their life to be successful at dealing with their disease and really having a healthier life. So I just want to say before I get started with the presentation that iThemba Life is a platform that already exists. And as of today, it is available for people living with HIV and for addressing also COVID-19. And we are currently working in developing our dedicated workflow for people affected with TB. So all the feedback that we get from you is critical for us to really focus on the elements that matter. This is why it's so special for us being here today and being able to share all of this with you. This is really about co-creating and really addressing the problems that matter. So without further ado, I'm just going to move on to the presentation, and I'll be more than happy to take questions as we go if there are any. So I guess that the first thing that we wanted to highlight is that eliminating TB requires coordination. I think everyone in this room probably knows this. It is so critical that all the agents in the chain of care remain connected and coordinated to make really effective actions, to bring effective actions to results and outcomes. At the end of the day, what really drives the outcomes in healthcare are the people who can take care of themselves and who take action to remain adherent to treatment and engaged in care. But of course, they need help. They need support. They need elements around them that, that enable them to go to the clinics, to get diagnosed, to get treatment. And that's what iThemba is all about. It's really about empowering people affected by TB to really get access to these services and ultimately connect as well these clinics, these government healthcare systems, donors, and the laboratories in the chain of care to really provide that support to the patient. So I'm gonna talk about iThemba a little bit more in detail now, but essentially iThemba is a platform that currently provides support to all these 4 stakeholders. But at the core of it, the most important element is the empowerment of the people affected by TB to really take ownership of their health and their lives. And just to talk a little bit about what's the scope, as I mentioned a few minutes ago, iThemba is a digital solution. We really are looking at the technologies that will be available in the hands of people in the next 5 to 10 years to really leverage that and build a program that will be sustainable over time and that can leverage the fact that people have more and more access to mobile technology and smartphones. And oftentimes this helps leapfrog the lack of other infrastructure. And we've seen across the world how people who don't have computers today actually have smartphones and connect to, financial services or other type of services through their phones. So that's how iThemba was born. It's really a health management solution to support countries with limited resource settings. And as I said, there's a mobile app for individuals affected by disease, in this case by TB, but there are other elements that will support laboratories, clinics, and the healthcare system to understand the type of care that patients need to do a better follow-up, and also how the programs are working from a population health management perspective. iThemba is currently available for HIV, and we are, as I explained, working on developing the best solution for people affected by TB. And here is a summary of the 4 elements of the ecosystem that iThemba brings to a healthcare system to address all these stakeholders. We believe that it is very important that as we empower individuals, this information is also shared with their carers and with their healthcare providers so that the optimization of care happens at all levels. We dream of enabling people to take better care of themselves, but to do so, it's also important to provide the same information and the same support to those at the clinics who are taking care of people affected by TB, but also at a certain level, to program managers who want to understand at a higher aggregated level how the programs are running and where are the hurdles in the program. So going more into the details, on the top left corner, we have the core element of iThemba, which is the mobile application that people affected by TB will use and through which they will receive results, appointments, recommendations, reminders, education, and other elements that my colleague Dana will walk us through a little bit later. And tied to these, we have on the bottom left corner what we call the implementation web tool, which essentially is the element that enables a scaled up rollout of a program for thousands for millions of patients. This is the element that enables to run data operations and to guarantee the integrity of the data that comes back to users, and also enables the laboratories or the operators at a country to essentially have real-time access to the data of the iThemba program. On the right side of this slide, we have on the top right corner the healthcare professionals reporting tool. And this is the element that essentially connects people and individuals with their carers at the clinics. These reports will provide curated lists and curated list, a group of individuals who need follow-up with the specific information that can improve, optimize, and help a better follow-up from the nurses and physicians to these individuals. And on the right bottom corner, we have the program manager's dashboard, the Insights and Analytics dashboard, which essentially compiles this information, disaggregated data, and really can show insights and analytics that speak of, how the interventions happening at the app level are translating into healthcare outcomes, and how also interventions that link the laboratory and the clinic also contribute to those outcomes, and providing visibility also of other elements of care. We will talk about that a little bit later as well, that may help improve the programs and drive decision-making at a programmatic level. So these are the 4 elements of iThemba, but today and in the next few minutes, we're going to really be focusing on how bringing this app to individuals affected by TB can actually drive adherence to treatment and can actually drive engagement in care from the beginning to drive individuals affected by TB to be diagnosed and be followed up in different countries. I'll take just one more minute to touch upon certain elements that I think are critical when we talk about digital solutions. To start with, iThemba provides, as you will see, result return into individuals' phones. And because it is critical to make this a universal service, iThemba is an open interoperable platform that is agnostic to the diagnostic platforms. So what this means is an individual who walks into a clinic doesn't need to understand if their blood sample, if their test sample is going to go to a laboratory or another. That should be absolutely transparent for users. The second point is this is a platform designed for the lower end phones available in the market. And this is really to make sure that we make it accessible to those who are actually having access to this type of technology, which is prevailing in most of the countries where we see these limitations in infrastructure. So older, less expensive, really low-end Android phones. And it will become available in iOS as well very soon. There's flexibility to localize the solution to countries in terms of language, in terms of workflow, in terms of clinical guidelines, and ultimately all privacy and security elements that are required by regulation, of course, have been taken into account. But on top of everything, iThemba has been designed to minimize the risk of disclosure and to minimize, I would say, the exposure of individuals living with TB, individuals living with diseases, to disclosing this information to others. So this is at the core of the design of the application, and hopefully that actually lowers the resistance to join the programs by individuals affected by disease and by TB. I'm going to hand over now to my colleague Dana, so she can talk a little bit more about the medical value and the impact aspects of iThemba.
Thanks, Alejandra. So our vision really is that iThemba MTB is a comprehensive disease management solution, as Alejandra said, that empowers people affected by TB, but also reduces the burden of TB diagnosis and follow-up care for individuals and for programs. And we do this through direct result delivery, which provides simplified logistics for timely delivery of TB molecular test results, and that also supports linkage to care. There's also print and multimedia education components that increase knowledge and provide medication adherence support. And as Alejandra mentioned, there's tools for healthcare workers and for program managers that streamline the clinical management and program management. Disease elimination programs. Alejandra, yes?
Sorry, I think it cut off. If you can repeat your last sentence.
So I think I was talking about the fact that we have the tools for healthcare workers and for program managers to streamline clinical management and program management.
Okay.
And that you know, we recognize that there really is a common challenge in disease elimination programs of linkage to care and medication adherence. And that those challenges are often because of the complex logistics of returning results to individuals and the burden of ongoing care and treatment. And since we started initially with HIV, the value proposition for iThemba MTB has some similarities to that. The iThemba HIV app was developed and piloted with partners in South Africa. And we completed this pilot study recently, which really demonstrated the feasibility and acceptability of the intervention with 500 HIV positive adults that were enrolled in 2 health centers in Johannesburg. And this study demonstrated that iThemba can deliver HIV viral load results to participants' smartphones, that it can provide results faster than the standard of care, and that users really were eager to use iThemba to receive their viral load results. We found that enrolled participants received their viral load results 10 times sooner with the app than prior to using the app, and 5 times sooner if their viral load was unsuppressed. And it really was this speed of notification that led to the majority of participants wanting to continue iThemba usage to obtain future viral load results, and also recommending it to others. Additionally, it was interesting to see that users with unsuppressed viral loads had a confirmatory viral load 2 times sooner when using the app than prior to app use. And this really demonstrates the potential of iThemba to decrease time to HIV viral load resuppression. But of course, you know, these results need to be confirmed outside of South Africa. They also need to be confirmed with a larger number of individuals with unsuppressed viral loads. But we really do feel that this pilot study demonstrated the feasibility and acceptability of this solution. And then on the next slide, I want to show you the general result return workflow of the app. And just to mention that all of the screenshots that I'm going to display during this presentation really are for illustrative purposes only and would be contextualized for intended users. So the workflow for the mobile app is that the individual first downloads the application onto their personal Android smartphone. The sample is collected, and they scan or manually enter the sample barcode into the app. The sample is then transported to and tested in the central laboratory. A notification is sent to the individual's phone when the result is ready. And then they log into the app to view their result and the recommendations for next steps. And so on the next slide, you can see that the iThemba app is designed really to go beyond simple result delivery. And the app supports people affected by TB with targeted educational videos, with appointment reminders. It can track the longitudinal test results and also provide medication adherence support through daily medication reminders, self-reported dose tracking, and other behavioral incentives. On the next slide, you can see that additionally, the app allows for multiple users on a single device. And we think this is important because this can potentially support an outreach model where a community health worker could receive the results for multiple people in a community who don't have access to a smartphone, and really enables community empowerment and community support of the TB program. The app also supports differentiated service delivery of individuals based on set parameters. It can allow for multi-disease approach, including HIV, hepatitis, and cervical cancer screening, in addition to TB. And also through surveys, the app allows for the collection of community reported data on service delivery. So for example, you could ask about quality of care, again, from the user's perspective or the client's perspective. And also surveys allow for TB symptom screening through the use of the surveys. And that actually is a key feature, particularly for users in an HIV program, because then we would be able to ensure that TB screening was done routinely in that population. So this is a really brief overview of iThemba. And on the next slide, you can see our contact information. And we're really interested in anyone reaching out that has a desire to help us collaborate on configuring the iThemba app for TB or evaluating the app in their country or program. So I'll now pass it back to Alejandra, and we're really eager to hear your feedback and questions.
Thank you so much, Dana. I just perhaps will say that it has been a fantastic experience for us having the opportunity to learn from this pilot and from our activities focused on HIV, and then think of how we can extrapolate the elements of value that, as you said, are common across multiple disease areas, to really think more of, okay, what's the situation of individuals living with TB and what could be helping them through their lives. So as we learn from that experience, we're now looking forward to learning from you and your experiences to help us think a little bit farther on, are these the elements that will truly provide value and enable a program at scale? So we really appreciate very much your feedback. And as Dana said, please contact us either through these contacts or through the SubTV team. Thank you.
Great. So thank you very much, Alejandra and Dana, for your very efficient and to the point presentation. So that was fantastic. And I'm really glad that we can have some time to have an honest discussion, not only about just TB adherence support in general, but kind of get the feedback and inputs that you're looking for from the TB community at large and those who are here at this event. So we are actually moving on to my favorite part of the Virtual Innovation Spotlight, because it kind of reminds me of Shark Tank. But you know, it is really to, again, strengthen that feedback loop between the innovators and our partners, particularly our in-country partners, whom many of them have actually joined here from across the world. So I want to open up the floor to everyone. And I know when you do this, it can get a bit chaotic. And rather than me reading people's chat text, because I'm not very good at synthesizing, it would be great maybe if I can ask people who have questions or comments to raise your hand so I can give you the floor, as well as those who have written comments in the chat box, because this is like a small enough group where we can just maybe have a nice like chat over coffee type of discussion. That would be fantastic. So because we already have a couple people who have made some comments in the chat box, and I apologize, if some of you have tried to text something in the chat box. We learned in the middle of the presentation that Zoom had changed their chat box function, and we just learned about that now. So I apologize in advance. So maybe people were actually knew about what iThemba meant, and so I apologize again. So with that said, Vinak, I'm so sorry if I'm mispronouncing your name, but do you mind maybe unmuting yourself and asking your questions and letting us know which organization you're from, et cetera? That would be fantastic. Okay, maybe Vinak is having some audio issue, but one of the questions Vinak asked was, and this is more maybe a larger kind of discussion around TB adherence and what we can do collectively as as innovators, as the TB community at large, to support TB affected and MDR TB affected people to successfully complete their treatment, particularly during COVID-19. And so I don't know, maybe Alejandra and Dana, from the market research you've done, from the on-the-ground experiences you've had, even with HIV, I don't know if you had any thoughts about that, because I'm sure that must have fed into kind of not only the initial development of iThemba, but also why you're also interested in translating the solution for TB.
Sure, I can take the first half, and Dana, please help me as well. I think that actually Dana mentioned something that to us was a great learning from our pilot, which is time is of the essence for individuals who go to a clinic, take a test, and oftentimes take months to get the results. Knowledge is power, and we as individuals need to know what's going on with ourselves to take care and action, and to understand why it is important to remain adherent to treatment. And oftentimes it is this element that's missing. What we observed in our pilot was that those individuals who received their result within hours or within days of going to the clinic to withdraw their bloods were more engaged in the use of the app than those who received it later. So our takeaway from this was, we really need to keep in touch with individuals, because that will generate more interest from their end to understand what's their status, what's going on, and what they have to do to get better. We did a lot of research with people living with HIV in clinics and outside of like user groups, and they were fascinated with the education content. I think that's also another critical element to engage individuals in care. Having access constantly to the content and information that explains, what is this disease about, and why is it important that I take my treatment, and how is my treatment actually getting me better. Oftentimes, people have to rely on the time that nurses and physicians have at the clinic to provide with that education, and that doesn't happen that often. So these are the elements of support that we believe are most critical in iThemba to support that adherence to treatment and identification of the patient's status. Of course, the reminders and the confirmation of medication intake are critical as well. But we believe that the education component and like making them aware of their status is the cornerstone where everything starts. And please, Dana, complete what I said, because I probably missed something.
No, I think you hit it right on, Alejandra, and I think it really is about the timely delivery of results, because essentially, I think what we've heard through, at least in HIV from the focus groups, is that it really was about the reliability of knowing that the result was going to be there and was going to be there in a few days, as opposed to returning to the clinic and finding out that the sample was lost or that they can't find the result, and really being motivated, but then demotivated because of the healthcare system challenges that people encountered. And then also, I would say, by incorporating things like the ability to do differentiated service delivery that also supported adherence and motivation on the individual level, but also supported the program, which then was able to help focus their attention on individuals that actually did need additional support. So I would say that the app is really trying to go beyond just monitoring adherence, but really to support adherence. And I would be interested in hearing from the group some of the differences between TB and HIV, that in TB, there's more of an emphasis on monitoring than there's more of an emphasis on monitoring than there is in HIV programs, in the sense that there's the history of DOTS, and in HIV, there really is not that same history. And so my question really for the group is in the app, what we have is self-reported adherence, and is that actually acceptable in the TB landscape? Because again, based on experience in HIV, it is, and it sounds like we've heard mixed feedback about where the TB programs are moving as far as monitoring versus support. But I would really like to get feedback from this group as well.
So while I think that's another macro level discussion to have with this group, I think just to follow up on another question that Anak asked, because I think it's the same kind of question I had when I first saw this presentation, is iThemba a solution that is more geared towards healthcare providers, or is it something that is more geared towards the affected people, and how real time is that exchange between the healthcare provider and the affected person?
Yes, I can take that, Jacqueline. And to be brief, iThemba is directed to all the stakeholders, but at the core of it is really directed to the individuals affected by TB. If individuals don't receive this support, no matter how much you provide to the healthcare provider, but individuals may not come back to the clinic, individuals may still not be motivated to complete their treatment. But we recognize that once you motivate the individuals, they also need to have the response at the clinic. We need to provide the clinic also with the means to focus on those who need the closest follow-up. So we are trying to address all of those needs with the 4 elements of the solution. And as I explained at the beginning, today we just focused on the individuals living with TB app, but there are other 3 elements that speak to the needs of the clinic and the nurses and the program managers in the laboratories. So if a healthcare system would decide to roll out a program like iThemba, they would of course be able to choose if they would like to run all 4 elements or only a few of them. But we believe that everything is connected. Also, sorry, to answer the second part of your question, how frequent is the exchange of with the clinics? How often do they receive these reports? That depends on the needs of the clinic. Some clinics may need to receive it once a week. because that is a frequency that's good enough for them to do an effective follow-up. Some clinics may need it more often or even more spaced out. And that is something that can be configured.
Okay, so I know that Viorel and Leah, I'm going to give you the floor shortly, but I want to at this time go to Humiza's question. So Humiza, I see your comment and question in the chat box. I don't know if you're able to unmute yourself and maybe speak to us directly. If not, I'm more than happy to synthesize the chat that you wrote. Okay, so then I think Humiza is one of our colleagues from TB Proof from South Africa, a really great civil society community organization that's doing a lot of great work, particularly in South Africa, Southern Africa, and around the continent. And I think what Humiza is saying is actually a really great point, because I've seen this also here in Switzerland, where you have the COVID-19 vaccine registration process, and it's primarily online. And those who were able to more quickly sign up or leverage that site were people who were either younger or more tech savvy. And so I think the question that Humiza, or the comment Humiza is raising, and I guess it goes actually to a question that, or comment Leah made, is if you're going to segment your solution for a particular quote unquote customer base, is iThemba more for a slightly younger generation who are tech savvy? Is it more for the urban community, et cetera? So if Alejandro, Dana, you can speak to who do you think this app is best suited for, or how are you trying to address kind of the differentiated care that TB affected communities and people will need?
Again, I'll take this part, and please, Dana, chime in. So yes, naturally technology is more friendly for the youngest generations because they are more used to it and more literate about using phones. Nonetheless, we did do a number of user research, and also from our pilot, we incorporated individuals up until 65 years old. We did actually interview individuals older than that to test the use of the app, and there's a variety of responses there. So I would say that it doesn't cater only to the young. Any age could actually use iThemba, but we recognize that sometimes the elderly will have more difficulties. To address these, there are a couple of things. The design of the app is super simplified, so that is very intuitive, and anyone who hasn't had previous experience with a phone can ultimately find their way through it. That's why it is all very colorful, like the results are color-coded. So even if you don't read what's in there, intuitively, there's an immediate understanding of what those results may be, or the call to action as well. The second part is with iThemba, there's the possibility to actually address some other demographics that are sometimes a little bit more elusive, like adult men or the teenagers. And really we see an immediate opportunity to address those demographics who sometimes are a little bit more at risk because for cultural or circumstantial reasons engage less in care. And ultimately, as I said at the beginning, we're looking at the horizon for the next 10 years. And we have to also acknowledge that generations, will become more familiar with technology over the course of the next few years. And perhaps the last point is supporting communities, because I also saw some comments in the chat about this. One of the elements that we're also looking at is the access to internet in rural areas, and how we can enable use cases where a carer may use the app for an elderly, or a community worker may use the app to educate and to provide results to multiple individuals in the community. So those use cases are enabled by the app, as Dana walked us through, with multiple users per device as well. Dana, please.
Yeah, and I guess I would just add from our experience in the South Africa pilot, that the users that reported difficulty viewing the results of the app, the majority were actually able to overcome those difficulties with the assistance of family members or community members. So I think we just have to remember, that, we all know that our parents and grandparents, right, they live in families and communities that actually can support them to access the app and bridge any digital literacy challenges that arise.
Okay, so I'm going to, oh, sorry, go ahead, Dana.
No, I was just going to say, and so, and to me that showed that even that population that was having some digital literacy issues was really motivated to view their result. And so they sought out family members to help them overcome that small barrier.
Okay, great. I know there's still a lot to unpack there, but Theo Rao, one of my colleagues at the Stop2 Partnership, has been patiently waiting, but I was purposely trying to make him suffer a little bit. Just kidding. Or no, I wanted to give the floor to our partners more than my own colleague.
I know. What you do, I know.
No, but please ask your tough question.
Thanks, appreciate, and thank you, Alejandra and Dana. It's a great presentation, and I guess it's very promising solution here. And I work with Jackie in Stop2 Partnership, and I'm head of the country and community support. And we also promote digital technology solutions. And particularly, we had this One Impact solution, which is an app that allows people to report some barriers to health services and so on. And from our side, I mean, we're definitely very open to discuss with you some ways of, interaction. And it's good to hear that you mentioned that this solution is interoperable, so we can link some elements together. And also, there is another team in Stop2, which is TB Reach. They also support different digital solutions, especially those related to video-assisted, treatment care and so on. So it also would be interesting to, see how we can link all together. That would be great. From my side, I have like several questions. I didn't want to put them in the chat, but no particular order. Just curious to know how did you guys approach this in terms of, I understand that this solution needs a health facility and workers to be on another side, right? Especially those in lab and so on. How do you incentivize them? I mean, it's like how, because I understand it's like I can have an app, but if the lab is not connected to this, then probably nobody will send any results to me. So I mean, how do you incentivize the health system, kind of like and clinics to use it? Some results I mean, it's not so simple, right? You cannot send the positive results to people. Sometimes you need to combine them with counseling and testing, right? So how do you guys like link the medical workers here? Because I mean, I understand that sometimes you cannot just send a result saying it's like you are TB positive, right, or HIV positive or whatever. I mean, you need to accompany this with some specific support. That would be interesting to understand if you put some thinking around this as well. Privacy and confidentiality, of course, this is kind of like an issue which is very heavily discussed everywhere right now, right? So how it is covered in your solution in that respect. And the last one probably is you mentioned that QR code that is scanned and so on. Is it kind of universal and can be applied for other companies' tests, or this is like pure Roche product that is included here? I guess that's too many questions from my side, but again, thank you. It sounds very interesting and promising solution. Thank you. Over to you, Beck.
And maybe very quickly before Alejandra and Dana, I give you the floor, because the data and privacy thing is something that I'm very, very, very passionate about. Just knowing who owns the data, how the data is stored, how is that data going to be used? Is it going to be sold to third parties, et cetera? Is it anonymized? Like, I think those are the many data privacy issues that we are grappling with, particularly for a lot of these digital health solutions, just to add color to that context.
Yes, thank you for that, Jacqueline. And perhaps I will start by the latest questions, and then I will give the floor to Dana to address some of the more clinical ones. Privacy and confidentiality in data use. So, as I mentioned earlier, this qualifies for an entirely dedicated conversation. I'll try to be brief. This is at the core of the design of this solution. And of course, we are considering the regulatory framework for the countries that we're targeting. As I said, countries with limited infrastructure, but GDPR and HIPAA, as an example, are the reference that we are taking for the compliance, for complying with data regulation. I mentioned also, by design, confidentiality is considered in every screen design, every notification, to minimize the risk of disclosure and to put the individuals at ease when they are using the app. As an example, we don't collect names and surnames. We minimize the use of PHI. And ultimately, the user identifier is the phone number. And all of that is, of course, to minimize the risk of disclosure and facilitate and reduce the barrier or the resistance to use by individuals. On the data questions, Jacqueline, this is a cloud architecture. This is a software as a service, essentially. And the data resides in AWS servers. We use our security controls for the Roche Navify platform that resides on that runs on AWS servers. There is data that is generated at country. The test results are generated by the healthcare provider, belong to them, and remain where they are created, either in LIS or whatever that database that is in use. And there is self-reported data that is generated within the iThemba cloud infrastructure. Always the healthcare provider will have access to all these data, but ultimately this is generated and resides in the cloud infrastructure. We, as a company, Roche, we don't sell this data to third parties. That is not considered at all. And Roche has access only through the dashboards, let's say, to aggregated data, definitely not individualized data at all. That is only for the healthcare providers, and we can provide more color to this in further discussions. But I think I hopefully addressed some of the hot topics that you mentioned, Jacqueline. Also, Viorel is absolutely right. We mentioned it at the beginning. This is not working only for Roche tests. This is a solution that is agnostic of the test provider. precisely to be able to increase access to all individuals who can benefit from this solution. Going back to the incentives, what could motivate a laboratory, a clinic to use iThemba? Well, the main, actually, 2.5 or 3 years ago, when we were still thinking, you know, how can we bring value beyond the laboratory as Roche and support the programs and the generation of healthcare infrastructure, the first ones who came to us to provide a solution were the laboratories. Because ultimately they are measured against turnaround time and against individuals receiving their results and clinic receiving their results. And oftentimes this is the element where the gap exists. And today there's a lot of value generated in the laboratory that doesn't necessarily make it into clinical impact, because these results don't make it to the clinics and therefore don't make it to the final recipients, the individuals living with the disease. So this is the main motivation for the laboratories, actually, to improve their key indicators, key operational indicators around turnaround time to return results to clinics and to ultimately individuals. And we find that's a very, very strong motivator, because again, this is something that it falls under the responsibility today in most cases, in most settings. On the clinics, we've had feedback from the nurses to say, this can save time at the clinic. This can help me focus on those who need it more. If patients are educated at home, they will come to me with the specific questions and I don't have to repeat them over and over the same messages. Oftentimes, you know, patients receive education on their first visit, but they don't have time to receive education further on. So there are some elements that are motivating to the clinic because they can focus and be more efficient. And as Dana mentioned during the presentation, helps them streamline the workflow there. So please, I'll hand it over to Dana to complement, of course, any of these responses.
Yeah, the only thing that I would add is I think, again, based on our experience in South Africa, as Alejandra is mentioning, we did focus group discussions with some healthcare workers, and they essentially saw the benefit of the app of linking individuals to care. And so that the app is acting as a push system to actually push individuals back into care, and that actually saves them time and effort because they don't have to use that time to, you know, to do home visits and phone follow-up and things like that. They have the support of the app as well. And then I also wanted to respond to Virabel's question about, you know, that there are certain situations where you wouldn't want to tell someone directly their positive result because there's other education that needs to go, you know, needs to support that. And we actually thought about that a lot when it came to early infant diagnosis for HIV, right? Because again, since that really was a diagnostic test, we didn't want to tell, you know, families or carers that the child was HIV positive directly. We wanted them to really come back to the clinic. And so for that, we really are focusing not on providing the result, but telling individuals that the result is available and they need to return to the clinic. But again, it's the same idea that they will know that the result is available, that the result is there, and they'll be more motivated to return as opposed to wondering if when they get there, is it going to be there or not.
Thank you, Dana. And I would just like to complement that because I also saw a comment on the chat that referred to configuration of the app. So the language can be configured to those languages that are spoken in a given country, for instance. And also we need to understand that guidelines in practice may vary from country to country. I mean, without the may, it varies from country to country oftentimes. So there is a possibility also to configure these screens to really fit the guidelines and the processes in use in a given country. So some healthcare system may choose to return results directly. Some others may want to go with an approach like Dana explained, which is a little bit more like a tangent where we communicate that there's a result available. But the flexibility is there to really adjust to the clinical guidelines in place.
Great. So thank you so much, Alejandra and Dana. I think there's still a lot more to unpack, but we are literally at time. So maybe if anyone here, Janina, can you maybe put up our deck? If there is any follow-up questions that any of you have for Roche, I think you were able to see Alejandra's and Dana's email addresses, but also feel free to email us and we will facilitate an introduction. I think, you know, there is a lot of synergies here, particularly as Viorel mentioned. We have been engaging with multiple digital adherence technology providers, particularly as COVID-19 has really made people stay at home and trying to provide treatment support while they are home during COVID-19 has become something that has been critical, and that we see even past the pandemic, whenever that might be, will remain. And so I think this will be interesting to see the various synergies we can maybe bring together for all the different sort of digital adherence technology developers. So I think with that said, oh, thank you, Dana. Yes, very good idea. Before we close the virtual innovation spotlight, I just want to give everyone a heads up regarding some, Janina, can you maybe put up our deck?
You should be able to see that technically now. No?
Oh, okay, can you? Okay, great. Yes.
Great.
So we have some exciting VISs that are coming up that we're organizing in the coming weeks. And the last two of these series will be on WISE's AI-enabled mental health application, as well as Canary's breath-based real-time disease detection platform. So, you know, we will be sending out our usual invitations. And if you're not on our mailing list already, please send us an email at ez@stoptb.org. But to be honest, the best way to learn about all of StopTB Partnerships event is by following us on Twitter. So with that said, I just really want to thank Roche Diagnostics, Alejandra and Dana for a really great presentation and one of the richest conversations I think we've had in terms of just learning really about different types of solutions and particularly your solution. And I'm sure there'll be some follow-up conversations. So with that said, thank you very much to Alejandra and Dana and for everyone here for joining and asking some really great questions that hopefully our Roche Diagnostics colleagues and friends found useful. So with that said, please have a safe and nice day.
Thank you. Bye-bye.
Thank you.
Thank you. Bye.